Unemployed social workers have staged a picket outside the KwaZulu-Natal Premier's offices in Pietermaritzburg. They say the demonstration stems from the Premier's failure to address the concerns raised in a memorandum submitted in March this year regarding the employment of over 2,600 unemployed social workers. The unemployed social workers include some who were sponsored by the Department of Social Development. They say they've been unemployed since completing their qualifications between 2009 and 2013. The unemployed workers say the shortage has resulted in unnecessary pressure on existing public servants, leading to absenteeism, burnout and delays in attending to critical cases, including rape victims, foster care grants and counselling services. To unpack the social workers' grievances, we're now joined by the Provincial Chairperson of the Public Servants Association in KwaZulu-Natal, Mlungisi Ndlovu. A very good evening to you. Thank you so much for your time. I mean, on one hand, there's a shortage of social workers in KZN. On the other hand, social workers have been unemployed, some since graduating from as far back as 2009. That's deeply concerning. Talk to us about the call to action that's resulted as a result.
No, thank you so much. Greetings. As PSA KwaZulu-Natal, we have been very concerned with regard to the lack of planning, as you have clear outlined in your opening statement that these unemployed social workers, in actual fact, they have been sleeping outside the Premier's office since Monday. There have been no Premier or member of executive committee or senior leaders that have been sent. Some of the delegations that have been sent, they were not willing to engage because it's a lack of planning. It's nothing else. You will notice that most of the departments are really struggling in terms of the workforce plan because they always want to compromise compensations and benefits of the employee. From 2013, there is no progress in terms of employing these social workers. Our current members that work in the different service center, you find that in the big ward like eThekwini, if you look at Ward 1, it's one of the biggest wards. You find that there are minimum of social workers that have been allocated. Increasing of gender-based violence, all other social illness. But what we're not getting to the department, the response is that they don't have money. And we are aware as PSA in the province that we're dealing with some of the cases where they are paying a judge 75,000 per day in one of the litigations in terms of the cases. This is not acceptable. We're dealing with health. We've seen some progress in other departments where they are able to employ, but they've put moratorium in all the departments. As a PSA, we believe that this department, even small institutions, they cannot be able to employ more social workers because they are told that they've overspent. We ask the questions whether the accounting officer, do they still apply the constitutions and applying the law? And you cannot have minimum of social workers where people are being raped out there. They are victims of gender-based violence. It's something that needs to be attended. We are calling on the minister because we are aware that the minister was in the province, but she did not have time to see these social workers. We are saying the Premier must be able to assist. By the way, it's not only social workers, even nurses are there. There's frustrations in the province. We are saying to the Premier, they need to take full responsibility in terms of the workforce planning because the public servants cannot be able to take it anymore. There is higher level of absenteeism, there is depressions, there is burnout. Some of them have decided to resign and leave the service, which is not good for the public sector.
Now, you've made a number of demands as you call for some sort of reaction from government. One of them is merely a call for transparency. You want the department to now release statistics on budgeted social worker positions, resignations and terminations. What kind of clarity will this bring?
So today we're visited by some of the directors who came to us who wanted to meet few people. They could not be able to give these figures. They need to be transparent. They must indicate, because we are aware from 2020, some of the social workers passed away. Some of them have went on retirement, but they are not feeling post. Why the public servants should be abused? If you find long queue, they don't get assistance, and the citizen fight with the public servants. We are saying the Premier has a responsibility. They must release these statistics, because in our calculation, there are more than 3,000 vacancies that are in that department. Many of the people are acting the position. In the province alone, as PSA, we believe that the province has over 20,000 vacancies. We have seen the movement in Gauteng, how the positions are filled, but the leaders are giving us that they have overspent. Who has overspent? What are the actions that they have taken? How the money is wasted on the systems? So we are saying we need to protect the public sector. If you cannot be able to provide the proper staffing, how are you going to provide services to the citizen? They need to be transparent, because they are saying they've arranged the meetings where they will be able to meet with concerned people on the 5th of June. Why they should wait? The memorandum was sent to the Premier on the 11th of March. Why the Premier has not responded? I'm saying as we speak now, these kids, most of them are women, young women. They are sleeping outside. They have no food. They have no transport. Some of them, they come as far as Newcastle, Zululand. No one is coming to them. As PSA, as a non-political allied union, we are raising these issues, and we have been consistent to say the minister, the MEC, they must be able to respond, because we cannot be silenced where our public servants are being exploited. You know, we are overworked. We need action as in yesterday.
You made mention of nurses being in the same boat. We know that these pleas also for employment mimic those of qualified doctors who marched last month to protest because they were not being hired. It also happens to be, as President Cyril Ramaphosa signs the NHI bill into law today. What is your reaction to that, given the sort of ecosystem that's needed to run the healthcare services in the country?
As PSA, through our national leadership, we have indicated that we want to see this universal care. But what is important that PSA has raised fundamental actions. Government need to respond. How are you going to provide the staffing in these aging health facilities? Most of the hospitals are aging. Positions are not being filled. Whether the private sector and public sector are ready to be able to implement this NHI, because we should not just formulate legislations. You'll agree with me that there are many legislation that has been formulated, but they did not respond to PSA, because we are saying as we speak in the Department of Health alone, there is shortage of nurses, there is shortage of clerk. How are you going to administrate this process? What's going to happen with the people who are holding medical aid? Because even the private sector cannot be able to cope. Are they ready? If you can go to Prince Mshien today, you'll find that at Umlazi, people are overcrowded. There is shortage of staff. They are not allowed to advertise position. You're sitting with those crises. PSA is not opposed to this particular universal healthcare, but what we are saying, we must engage. We must not introduce a policy that will fail. Who's going to find it? Because currently there is not even a middle class, because public servants and the workers at large are struggling. There was increase in terms of VAT. There's a lot of things that has increased. So the employee cannot be able to fund, because majority of the cash revenue come from the employees. So we are saying they must be upfront. They must give us answers. We have been picketing at PSA in the province, talking about shortage of doctors, shortage of nurses, and we do appreciate that in the province Department of Health have able to convert over 2,000 contract workers. They've now advertised 120 positions of doctors, but it is not enough. The citizen has increased, the population has increased. As PSA, we are saying respond to those questions, because most of these leaders use medical aid, so they don't understand what we go through and what our members go through. As PSA, we've got many members in the Department of Health. Members are asking questions. There is an act now that needs to be implemented. So what we're saying, government must be transparent, because if they think that they will increase payers who earn, so they are pushing us on debt. As we speak, most of the employee cannot be able to survive. The cost of living is very high. Inflation is very high. We must be able to work together to find solutions.
Absolutely. Thank you so much for weighing in on this discussion. We're going to have to leave it there for now. Provincial Chairperson of the Public Servants Association in KwaZulu-Natal, Mlungisi Ndlovu, giving us some reaction there to the NHI and, of course, the crisis around hundreds of social workers who are still unemployed in KwaZulu-Natal.